you need to honor those exemptions. I mean, otherwise, this is just state-sanctioned discrimination, and that's just not
Right.
okay. And these are our most vulnerable Texans that are no less worthy of informed consent
Absolutely.
and vaccine choice than any cash pay patient. Let's be clear, this is a human rights issue. Welcome to the final episode of Shock Callers for 2023. This has been one of our newest endeavors this year, and we're so excited about all of these special guests that we've had this year. As our last episode, we thought we would do a year in review, and I'm here with Michelle Evans, our political director, and we're going to do just a little recap of 2023 for everyone.
Yeah, it was definitely a momentous year for us.
Yeah.
So we want to go over all the highs, the low lows, even though there were very, very few of those blessed. But we wanted to talk about what TFVC has been up to all of 2023.
Yes. Well, I feel like we need to backtrack a little bit to December 2022, because that is when we launched our first petition for the regular legislative session. So why don't you talk a little bit about that, Michelle?
So going into the legislative session, we were on day 1,000 plus of the governor's emergency orders. He indicated that he would not lift those emergency orders until and unless the legislature passed a ban on COVID vaccine mandates and mask mandates. So we knew that we needed both the governor and the lieutenant governor to announce that as one of their legislative priorities. So going into session, we distributed a petition for TFVC supporters to sign so that we could flood the governor's mailbox with thousands of signatures in support of finally putting an end to COVID vaccine mandates and mask mandates in Texas. And he listened, he responded, and he put that as one of his top 4 or 5 legislative priorities. And likewise, Lieutenant Governor Dan Patrick put that as one of his top 30, which is a lot. But out of that, we got SB 29.
That's right. Well, and then let's go backtrack just a little bit, and that our first kind of big event during session was our 5th Freedom Fight and Rally. So that was really it's always fun. Our rally is our biggest event, or actually it's not, I don't know. I guess it was our biggest event of the year.
Yep.
And it always is. And it was so well attended. And we had a really tremendous lineup of speakers. Why don't you give us a lowdown on our Freedom Fight?
Yeah, we were stacked. So we had the most legislators we've ever had show up, and not just show up and wave and say goodbye. They wanted to speak. They wanted to address the crowd. They were really hyped to get into the legislative session and protect medical liberty. So it was a really great way to set the tone. But of course, we had other speakers like Brandy King, who was a former military servicewoman who has been battling COVID-19 vaccine mandates in the armed forces. We had Laura Cox from Airline Employees for Health Freedom, numerous doctors whose names you would recognize, Dr. Gamboa, Dr. Artis, and more. But of course, our headliner was the fiery Del Bigtree, and he really, really got that crowd going. So we were super happy to go into session, because this was late January that we had our Freedom Fight and Rally. So it was really great to go into session with all of that energy from, the doctors to the former military service members to the legislators. It was extremely important that we had everybody on the same page with the same mission.
That's right. All right. So let's get a little nerdy and talk a little bit about legislation. And the good, the bad, and the ugly of the bills that were filed.
Well, let me start it off by saying that this year we had far and away the most supportive legislation filed than we've ever experienced. Typically, we've been on the defense in the past. Our goal has always been to kill bad bills, and there has been, a handful of good legislation filed. This year, we were supporting 60 bills that were intended to protect and advance medical liberty. So that was a heavy lift. That was,
I don't know what you're talking about.
It was a blessing. Yeah, right. It was a pleasant surprise, but it was something we were ready to take on, and we did it with vigor. So the number one bill that we wanted to really get passed this session was House Bill 44 by Valerie Swanson. It was carried in the Senate by Senator Mays Middleton. It has long been our goal as an organization to protect the families that benefit from state-sponsored healthcare plans, such as Medicaid and the Children's Health Insurance Program, better known as CHIP. So we tried this last session and it was unsuccessful.
And the session before, before. We call it our Medicaid discrimination bill. And this is when we first started, back in 2015, and it continues to be, not now, but it continued to be one of the top phone calls we would get here at TFVC is, my family, we don't vaccinate on schedule, but we do utilize state services, and we cannot find a doctor that accepts Medicaid that will accept my family. And, if you are a state-paid doctor that has entered into a contract with the state that has long honored parental rights when it comes to vaccines, then you need to honor those exemptions. Otherwise, this is just state-sanctioned discrimination, and that's just not okay. And these are our most vulnerable Texans that are no less worthy of informed consent and vaccine choice than any cash pay patient. Let's be clear, this is a human rights issue. And so this has been one of our legislative priorities literally for 9 years. And it's just was so tremendous to have HB 44 fully pass this session. Yeah, I stole the headline. I'm sorry.
And to be clear, that's okay. No, one thing I do want to point out is that the Texas Medicaid Healthcare Partnership, which creates the regulations for these providers, has long upheld the right of parents to exempt their children from as many vaccines as they see fit. So it didn't make sense. It really didn't comport with the regulations that these doctors sign on, the contract that these doctors sign with the state. They were just not upholding their end of the bargain. So it was not an easy bill to get passed this session, but we were so happy that it did. It was such a blessing for all of these patients. And you've seen, since that's passed or since it went into effect in September, you've seen large clinic systems, large healthcare systems like Baylor Scott and White and others who have reversed discriminatory policies. And for many of these practices, it's far easier just to have a blanket policy of accepting exemptions rather than to have a carve out for specific patients. So we're hoping that it really does have this domino effect for all patients in Texas.
Absolutely. Why don't you talk about some of the other 3 standalone vaccine choice bills that were fully passed during the regular session?
The first one to go through, it was by far the easiest one to pass, was House Bill 609 by Representative Cody Vasut, again carried in the Senate by Senator Mays Middleton. And it sort of closes a loophole that was passed in a bill that was passed in 2021. But it basically says that if there's a pandemic, any pandemic, not just COVID, and a private business has opted not to follow public health guidance, so not to mandate vaccines for their customers or their employees or mandate masks for anybody, and a customer or an employee contracts the pandemic virus, they cannot turn around and sue that business owner. So it was a small but mighty bill and went through the House and Senate fairly easily without a whole lot of, I wouldn't say it's a far and away bipartisan bill, but it was very little fanfare. So we were excited to get that passed. It protects business owners from frivolous lawsuits. And so it was a really strong bill. I say it's small but mighty, but it is very impactful for small business owners in Texas.
And then SB 493.
Yes. That's by Senator Brian Hughes. It was carried in the House by Representative Cole Hefner. Also a small but mighty bill. So what it says is that if you were separated from the armed forces solely for declining the COVID-19 vaccination, which we know happened to a lot of service members, you will be made whole. If you got a less than honorable discharge, the state will make you whole for the purposes of veterans benefits in the state. So that can be, mortgages. It could be assistance with education. There are so many different benefits that veterans qualify for at the state level. So we got that passed, again, to very little fanfare. It was a bipartisan. It was supported by the bipartisan in both houses or both chambers. So very good bill.
Yeah.
And the last one I alluded to earlier was Senate Bill 29 by Senator Brian Birdwell, carried by J.M. Lozano in the House. It was not the most perfect bill, but it did provide that schools and other government entities can no longer force masking, vaccines, or closures for COVID-19 or its variants. So there were some carve-outs that came about in the House during the floor debate, specifically to like nursing homes and state assisted living homes. But for the most part, after SB 29 was passed, a majority of Texans were free from government mandated COVID interventions.
I think that's a really important distinction. These are just the government implemented COVID restrictions. So while the government restrictions ended, we had this pesky little problem with all of the privately employed Texans in the state. So, and yes, you want to talk about the fate of HB 81?
Well, I don't want to get into the fate of HB 81. It didn't pass. It was the Texas COVID Vaccine Freedom Act by Representative Brian Harrison, again, carried in the Senate by Senator Mays Middleton. You're seeing a pattern here.
I am.
But Brian Harrison filed this bill in every single session that he's been in since elected to his seat in November of 2021. He has been dogged in pursuing the rights of Texans to decline the COVID-19 vaccine for any reason they see fit. And he was a real champion for this bill. It unfortunately just did not pass during the regular session. And there are many theories as to why it didn't get a vote on the House floor, because both the Senate version and the House version passed through the House Public Health Committee with bipartisan support. It met its fate at the end of the regular session. Luckily, over the summer, our focus, because we knew that there were going to be special sessions, Governor Abbott was very clear about wanting to continue the legislative session so he could get some of his priorities passed. He did not indicate at any time that vaccine choice was a priority, but we wanted to make sure that this issue stayed front and center for everybody in Texas, for every elected official. So we did another petition. And we wound up submitting about 3,000 signatures to him over the summer in a separate petition. And lo and behold, on the third special session.
Not just that, Michelle. I mean, talk about our other efforts during the summer to go with the county executive committee. And
so a lot of people don't understand, but each county has its own county Republican Party and county Democrat Party. And it's made up of all of your precinct chairs for either party. What we did was focus on those parties in big counties like Tarrant County, Collin County, Harris, my own Williamson, Travis. We submitted a resolution calling on Governor Abbott to put that on as a special session, put it on a special session call. We also, with the help of Representative Brian Harrison, approached different county governments and city governments. He was successful in getting the Odessa City Council to pass a resolution, basically decrying any sort of government mandate when it comes to public health. The Aransas County Commissioners Court also passed a similar resolution. So there really was like a huge push from the grassroots up for Governor Abbott to act on finally banning private employer COVID vaccine mandates and basically any of the leftover COVID vaccine mandates that were not addressed by SB 29.
Yes. And so between delivering this petition, encouraging these county executive committees, doing these, template resolutions for counties and cities to do the same, we were successful in, applying, it's pressure, but it's nice pressure to Governor Abbott to get him to add this to one of his special sessions calls. And so do we want to leap forward to that special session?
Yeah. I remember the phone call you and I shared where it was right after he announced that it was going to be, he put out the proclamation for the third special session and included private employer COVID vaccine mandates on that call. And you and I we were giddy. We were doing happy dances in our respective
I was out on my back porch, like with happy tears coming down my eyes. Yeah.
Yes.
My face. Yeah.
Because you never know. He had made the government vaccine mandates his priority. He could have just said, I did what I could do and that was it.
Yeah.
He could have listened to the business lobby who was discouraging anybody from getting involved in private employer mandates. He could have listened to the hospital lobby that also was discouraging banning any mandates, but instead he listened to each of you, who signed a petition, who went to your county executive party, who went to your county commissioners court and your city councils. So
who made phone calls, who sent emails, did all the work that is required of the true grassroots. It's just tremendous.
It was impressive, very, very impressive. And out of that came Senate Bill 7 by Senator Mays Middleton. It was carried in the House by Representative Jeff Leach. But not only did it ban, at the end of the day, once it was finally passed, it banned private employer COVID-19 vaccine mandates, including at hospitals. But with the help of Representatives Briscoe Cain and Steve Toth, we were able to strengthen it on the House floor so that medical students who are looking for a clinical placement, so that volunteers who are doing, credit hours at any place, a Goodwill, anywhere, anybody who is under the direction of a private employer, paid or unpaid, is protected from COVID-19 vaccine mandates. And then Steve Toth tacked on an amendment to make the consequence even harsher. So instead of being up to $10,000 per violation, an employer is on the hook for $50,000 flat per violation if the Texas Workforce Commission finds that they did violate an employee's rights. So it was a strong bill, an amazing bill. We were so happy to help shepherd it through and to see that finally passed. It will go into effect in February, but also, again, these large clinics, these large healthcare businesses are already course correcting. Even before the bill has gone into effect, they're already changing their policies. Medical students are already protected. So kudos to everybody who made a phone call, sent an email, signed a petition. Everything you did, it was impactful.
Yes. I remember earlier this week, I got a text from a clinic director and with a screenshot of the revised policy regarding COVID-19 vaccines for their students. And it just put a spring in my step. And I know this person was really happy too, because it's been really difficult for these, instructors that are trying to place these students in these clinical facilities. And, these students should be no less protected from, vaccine tyranny than a full employee. So it was a huge success.
And let's be clear, there's a healthcare shortage, a staffing shortage throughout the healthcare industry. So they should be welcoming anybody that wants to come in and help. And these students are not in a high risk category for the most part. They're not, they're in their 20s, generally quite healthy, very few comorbid conditions. So they're not at high risk for COVID. So it just didn't make any rational sense. And we're so happy to see that they are now fully protected. And thank you to Steve Toth, to Representative Kane, to Senator Middleton. I mean, we adjust it. We do a report card every year. You can go check it out on our website, TexansForVaccineChoice.com. You can see how your representative or senator, how they scored.
Yeah.
We had to adjust his score from an A+ to an A++, which is sort of a new thing for us, but he worked so hard.
Yeah.
I cannot overstate the gratitude that we have for Senator Middleton and all that he's done in 2023.
For sure. Well, I don't want to completely move away from the session because I feel like we left out like some pretty significant efforts during the regular session. And that was regarding our citizen engagement days and all the committee hearings and such, because that was really, I mean, I look back on these stats and I just think, did that really happen? Did we really do this? So we hosted 4 citizen engagement days. These are days where we invite anybody that wants to come and learn kind of the ropes of, advocacy and, what effective advocacy at the Capitol looks like. And across our 4 citizen engagement days, we had nearly 200 activists come. One included a busload, which was great. We were honored to partner with Pastor Brandon Burden and his North Texas conservatives, and he had chartered a full bus load of medical liberty activists, and I was thankful to hitch a ride on that bus. Lord knows I did not do not enjoy that trip down I-35
to drive.
It's my favorite. Driving's my favorite. And so it was so nice to be on a bus there and back to Austin with diehard patriots. And so across those 4 citizen engagement days, we made, goodness, I did the math the other day and it was it was well over 500 office visits. And like I told that bus full of activists on our way home, that is a needle moving activity. And we just could not have done it without all those people coming, sacrificing. I mean, it's no easy feat, even just getting to the Capitol, the parking, the security, with navigating that ridiculous building. I mean, all of it's no easy feat. And so the fact that we had nearly 200 people show up for, engagement days. This was not a rally. It was, true, navigating that building, office visit, engagement. It was a sight to behold.
It was absolute boots on the ground, which is the most effective way to be engaged and to get your representatives to care, is to show up and let them know why it's important to you. So it was so crucial to have those 200 plus citizens come to the Capitol. And really, since the beginning of our organization, since 2015, our bread and butter has been the everyday Texan who maybe didn't know, like we didn't know at the beginning, the legislative process. We try to kind of lift the veil there and give everybody the ability to be active and engaged in whatever way they can, in whatever capacity, whether that's sending emails or making public comment on the House page when there's a committee hearing. Whatever it is, we like to give you the keys so that you can really be a part of the process and have your voice heard. It's the most important thing to having a successful legislative advocacy organization like ours, is to make sure that everybody is included, because it cannot just be me. It can't be just you. We love to have all of that activity from the grassroots up. But you did mention hearings, and I don't want to miss out on the most memorable day of the session, and quite possibly the most memorable day, single day since our organization's inception, which was in mid-March, March 22nd.
March 22nd. I was going to, okay. It was a quiz. Is she going to remember? Right. It was March 22nd. Yes.
So beginning, end of February, beginning of March, we got a communication from a senator's office asking us to really help beef up the number of people coming to testify in favor of a whole slew of bills. We were told it was going to be a COVID day in the Senate. So we worked tirelessly to arrange and have doctors, patients, just advocates military, from across the state.
Pilot. We had pilots there, military there. We had doctors. The most memorable, I think, would be Dr. Malone. Robert Malone flew in and testified on nearly every single bill. And it was really nice to have his voice. Dr. Artis was there. Dr. Fleming
Peter
was
Fleming.
there. Along with, Dr. Farella and Dr. Nanda and all these just tremendous freedom-minded doctors. It was an incredible day to see. We had that entire corner over on the Senate floor. Just with. It was like an entire L. I think there were like 2 dozen of us.
There was.
People
we're all sharing snacks. And
we were keeping each other alive.
Yes.
And so it was such a historic day because so much vaccine truth got on the public record. And that, I think, is just something that sometimes gets is underrated. That, y'all went and did all of that, but the bill didn't pass. Well, why don't you speak to that?
Well, I think that what's important is that, so during the interim between the 87th and 88th session, the Senate Health and Human Services Committee really focused in the interim on having hearings that addressed what we did wrong and what we did right in response to COVID. And from that, they formulated dozens of bills that would correct those wrongs, sort of course correct the state. And so there were patients' rights bills. There was an omnibus bill from Senator Kolkhorst, which would have cleaned up a lot of existing statute and also gone further to protect Texans from vaccine mandates, et cetera. So having the truth on the record is significant. And what we did during that hearing is not only did we show that we were now in the majority, but we also showed that there was so much to address, even in the upcoming interim. So there's going to be things that we have been told are going to be discussed and investigated during the interim. Most notably, mRNA vaccines in livestock. There was a last-minute attempt to pass a bill that would require labeling of meat if it has been, if the livestock has been vaccinated with mRNA matter. So, and Bob Hall and Senator Charles Perry coordinated on that with the intention of this being something that they talk about even further in interim hearings and beyond. So it's sometimes if you're impatient, this entire legislative process can be extremely frustrating. And even if you're not impatient, like me, if you're just ready to watch it all kind of unravel, it can still be very frustrating because it seems like all you get is incremental stuff. But this year was so huge. We got so much passed and so much, like you said, on the record. You can go back and watch that hearing. It was a marathon. We actually had 10 separate bills heard in committee hearings that week, which has never happened ever before. So we can't gloss over that just because all of those bills didn't pass. We need to recognize that they, for the most part, passed through the Senate fairly easily. We just have some work to do on the House, and we'll focus on that as we move onward.
Yeah, and when the regular session was all said and done, we had testified in about 24 hearings. And we cannot overstate how significant, like you were saying, like this, we are the majority now. And the fact that we have committee chairmen willing to hold these hearings and, have these bills that we would have never even dreamed of even being filed, much less getting a hearing on. It was very historic. And so, we've been, like you said earlier, the vast majority of our efforts in previous sessions have been almost solely focused on killing bad bills. I think we had to testify in how many hearings on bad bills? 2? Was it 3?
Gosh, I don't even think I testified in that many. I think I kind of sat back and watched some bills that we had on our radar. But as far as bad bills, it was just the HPV one.
HPV one, right? Was it? I felt like there was one other one. Anyway, I just want to make sure that distinction is being made, that the vast majority of all of those committee hearings were for good protective legislation. It wasn't just killing the bad stuff, which it's just still kind of a hard thing to wrap your brain around. And we did.
We still killed the bad stuff.
Yes, we did.
Let's keep that.
We sure did.
We're still good at that.
Yeah, we have still have a perfect track record of killing bad legislation, and I will be I'm just gonna. We all deserve a big pat on the back for that. There you go.
Round of applause, like the Boy Scouts.
All right. So,
I want to put you in the hot seat now.
Oh, goodness.
Because
I'm ready.
Well, while I lived near Austin, so it's a blessing that I get to go to the Capitol every single day. But then I'm sort of tunnel visioning it throughout 6, 8, 9 months of the year this year. But in my, while I was focused on that, we were blossoming. Like TFVC was growing.
That's a good word to use. So yes. So in the beginning of 2023, we were able to hire one of our outreach coordinators in a full-time capacity, the amazing Carrie Bigford. And she came, I feel like she was just kind of this missing piece that we had been lacking. And she's just the Energizer Bunny and is full of the passion and vigor that is required for a endeavor like this, for sure. And she just has this heart of equipping everyday Texans to turn their passion into truly effective advocacy. And so she worked very hard to develop this kind of preliminary outreach program. We started the year with about 10 outreach coordinators. These are our core volunteers that, are trained and equipped and empowered to either host their own events in the communities or have a table at another event or, be a speaker at an event or just provide some sort of auxiliary support services at organizational meetings across the state. And she takes these outreach coordinators through a quick training program. And then once they are fully onboarded, they are equipped with a welcome kit and a go box and truly all the keys to the kingdom to be an effective advocate out in their communities, with the goal of turning these little pockets, these neighborhoods, these communities into these powerhouses of advocacy. People come to us all the time. What can I do to help? I want to get involved. And we say, we now have a program just for you. And so we have finished this year with over...
Excuse me.
Your excuse. We have ended this year with over 24 outreach coordinators. So we have more than doubled the program. And these are people that are out in the communities. I mean, we have hosted anywhere from 12 to 36 outreach events every month. And whether it's a trunk or treat or a table at a fall festival, or we have these pizza battle in these neighborhoods in Houston, and we've had a table there. I mean, we're talking going to these untapped populations that care very deeply about the issue, but perhaps just haven't heard of TFVC. And so we have been able to reach new Texans, expand our influence, bring on new advocates and new volunteers, new supporters. And it's just been just a remarkable, I mean, I talk about, we talk about legislation a lot here, right? I mean, that is, a tremendous focus of ours, because without protective legislation, Texas will just can go down the toilet, right? But I always say we have a hearts and minds issue too. Let's pretend we could pass any bill we wanted to in Austin tomorrow. We're not there yet, but let's pretend it doesn't solve the hearts and minds issue that we have in Texas. And so that's what I feel like is this happy marriage of our legislative efforts and our outreach program efforts, so that they can work really hand in hand to bring on more people, because we always will benefit from more grassroots assistance.
Yeah. And I appreciate it coming from the legislative arena. I appreciate being able to amplify the voices of those outreach coordinators and everybody that they come into contact with. And we've done some huge events too. I mean, we do these smaller events in individual communities, but we've also turned some of these OCs into really effective political operatives. That's not a great word for it, but I mean, we've got an OC in Fort Bend County who's been dogged. He has been going to these EC meetings. Yeah. He wants to know who's running and who's doing what, which is great. We've done the great homeschool conventions across the state. We had the Rand Paul book signing, which was full of OCs, and you and I went, and Carrie was there as well, and we were talking to Rand Paul about what makes us effective, and he was very impressed by the program and everything that we're doing. I'm trying to think of the Texas Youth Summit in the Woodlands was huge as well. I mean, we do small events, we do big events. We our OCs are really tapped into their community, and they're involved in a bunch of different groups too. So they're able to kind of diversify in their communities. And I think one of the best moments this year with regard to our OC program happened just over the weekend, when we got to see one of our rock star outreach coordinators, Mariah, be given the coveted sword, the Conservative Leader Awards at a gala over the weekend. She was being recognized for her really tireless work in her community and beyond, to talk about vaccine choice, but to also talk about other issues and advocate for other issues. So that was really amazing for us, you and I, to be able to, from our table for her and to see her really be honored for her work. But this has been, like you said, it was a missing piece. Texas is a big state, and outreach isn't necessarily my strength, and there's only so much that you can do as one person in North Texas. And so it's really instrumental to have somebody like Carrie, who honestly was born for such a time as this, and who knows what she's doing. She gets these people motivated, invigorated, and trained, and we're working on connecting both, my sort of side of things with hers, and going into a primary season and big election year, getting really connected with some of these pro-medical liberty candidates, and to educate them about, what our issue is, and to help them get elected.
Yep. I want to talk about you alluded to the Senator Rand Paul event. We had some other fairly significant, larger events this year as well. I think back in April, we had the Abilene Wellness Summit with Dr. Peter McCullough. I was honored to be a co-presenter with him on that event. And man, Abilene brought it. The Abilene Freedom League. I mean, I didn't know Abilene had that many people, and they all came into one event that weekend, and it was a tremendous event. And Dr. McCullough's ability to recall statistics and information is truly unmatched. We also speaking of the Conservative Leaders Award, we were honored to nominate Dr. Mary Talley Bowden for the TFVCs nominee this year, and that was just truly a privilege to see that room full of hundreds and hundreds of activists just give her the standing ovation that was so duly deserved.
And these were not all vaccine choice activists.
Remotely.
Obviously, 90% of them probably agree with us, but they are not super deep into our movement or this issue. But to see everybody just rising to their feet and screaming and hollering and clapping and just and sitting next to Dr. Bowden, it was like you weren't even able to eat a full meal at this event because people kept coming by and they wanted pictures and they wanted to thank her and they just wanted to shake her hand. And that's like she feels, I think, that she's doing the least that she can do, which is just sticking up for the truth. But it is so unusual in our society to see people willing to stick their necks out and really go against the narrative and sacrifice a lot to do so. I mean, she's been continues to be investigated by the Texas Medical Board for things that she said, not things that she's necessarily done, but there's definitely, she's being persecuted for things that she believes, which is very simple. Vaccine mandates are wrong. I mean, who can take issue with that at this point? I mean, we're in 2023. Come on. But yeah, get up. But people just love to see the fact that she is so courageous and steps out of her comfort zone. And I'm hoping that so many other people who watch her and see what she's doing, continue in her footsteps. She posted on Twitter about receiving the award. And I remember just scrolling through the comments this weekend and seeing so many doctors, people with initials after their name, chiming in and thanking her for the work that she's done. So hopefully she will set an example for so many people.
Yeah, we were texting the morning after the gala, and I said something like, I know you're not in this for any sort of acclaim, Dr. Bowden, but it is nice to be recognized, and I hope this sword kind of provides, renewed energy for this battle, because it's not for the faint of heart. I mean, let's be clear. Nobody wakes up one day and says, let's take on Big Pharma, right? It's truly a calling. And I know I speak for all of us when we say we're so thankful for her voice in this fight. For sure.
Absolutely.
The other kind of bigger event, well, there's two more that probably stand out to me. One was the Children's Health Defense bus tour. We were, Dallas-Fort Worth, it was their inaugural stop on their tour, and Texans for Vaccine Choice gave them, I think, a mighty send-off. We were happy to host them in Plano for their first stop on their new Vaxxed Unvaxxed bus tour, based off of the newest book by Dr. Brian Hooker. And it was a day where people could sign up for interview slots to go be interviewed on the CHD bus about their either adverse reaction to any vaccine or even their experiences being unvaccinated. They were also collecting stories for people that had been harmed or even killed by the hospital protocols. And some of these stories, were just devastating. It's a sobering reminder of why we do this work. It was, there was that whole day was a day of just kind of an emotional roller coaster, if you will, because there were people that were showing up that were, that had their just devastatingly sad stories of a loved one that was killed in the hospital. And then there were stories that were, where people were beyond courageous, or families that showed up with their, all of these kiddos that were completely unvaccinated and just thriving in health. It was kind of this mixed bag of emotions, but these stories were very important to be told, regardless of which spectrum it was on, which side of the spectrum. So, humongous hat tip to Polly, Tommy, and that entire crew on the bus. That is just tireless and oftentimes thankless work. And it was just such a privilege to partner with them for that event. They have a lot more Texas stops planned for 2024, and we will be equally as thrilled to host them on those additional stops. But that was really special. Just seeing Polly withstand that kind of emotional turmoil for the entire day. It was a sight to behold. And she, I know, covets everyone's prayers as she continues to, and that entire team really, as they continue to travel the nation collecting these stories. The other kind of significant events were we partnered with React 19 for this huge event in Montgomery County this summer. And, they are, I'm looking forward to being able to tell more of their story very soon. We have just what they have done in response to being injured during the COVID-19 vaccine trials. It's really a beautiful story of relationship and hope. And then in November, we were exhibitors at the Freedom Doctor Alliance convention in beautiful Bandera, Texas. And the first morning of that convention, I didn't post about this, but it was one of those moments where Dr. Farella had everybody in that room stand up and give and recite the full Hippocratic Oath. I had no idea how long this thing was. It went on and on and on. And I got teary-eyed seeing all of these doctors in this room kind of recommit themselves to this patient-centered care. And so many of the presenters had such a just vision and for just a return of the original intent of their profession. We kind of saw the entire medical industry get hijacked by a certain narrative during the COVID response. And there's a remnant, I guess, is what I want, the hope that I want to instill to our listeners, that they are truly finding the solution to create a kind of a parallel alternative, if you will, healthcare system that's truly focused on patients and actual true health.
Thank you for listening to the Shot Callers podcast. Please, if you found value in this content, rate us and share the podcast with a friend. It's a great way to get the message out and to empower everyone to make informed decisions. Until next time, never forget, we are the Shot Callers.